Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Health and being healthy is made more complicated than it needs to be. And often there's always doom and gloom about health. There's rarely a lot of good news. Well, here's some great news. Work out of Glasgow, and this is from Medscape UK, and the link will be in the part below. Type 2 diabetes, and I'm quoting, can now be regarded as a curable/reversible condition, according to the lead researcher for the major UK trial of weight management. Michael Lean, Professor of Human Nutrition at the University of Glasgow, told Medscape News UK that type 2 diabetes was reversible for more than 80%. That's 80% of people if they were, and these are his words, willing and able to take it seriously and lose over 15 kilograms. That's really, really good news. First important point to make. Type 2 diabetes is different to type 1. Now, in type 1 diabetes, the body is not producing enough insulin. In fact, may not be producing any insulin. And people with type 1 diabetes will need insulin injections, and they will need that for their entire life. Type 2 diabetes is quite different. It's not that the body isn't producing enough insulin or any insulin. It may actually be producing too much because the body becomes resistant to the effects of insulin. And insulin resistance, the term has been coined, is a precursor to type 2 diabetes. Insulin is the hormone produced from the pancreas that gets glucose out of the bloodstream, as the body likes to maintain everything in a particular range, whether it's temperature, blood pressure, heart rate, blood glucose, blood calcium, you name it. So if there's too much glucose in the bloodstream, the body produces insulin to get that glucose out of the bloodstream, and it typically does that by converting it into fat. The body converts it into fat and stores it, which is why we put on weight if we consume more energy than we need. If you put more energy than a car needs, you put more petrol into the tank, it'll overflow. It won't make the car get any bigger. So, the cars maybe have an advantage over us as human beings. But ultimately, that is the role of insulin. And it's sometimes quite frustrating for people when they're exercising and they've had some carbs for breakfast and the body is still in fat storage mode. It can be a bit frustrating for people who are wondering why they're not losing the weight. Difficult to be in fat burning mode when your body is in fat storage mode. So this is very, very good news. Type 2 diabetes comes about when over many years you've been taking in more glucose and carbs than what the body is happy to deal with, produces insulin, the message goes out to the body to store the glucose as fat. Eventually, the body becomes resistant to the effect of insulin. It's like it's switching off, insulin resistance, and eventually type 2 diabetes where your blood glucose levels are higher. Now, over many years in practice, I've seen people lose weight, and I should also say that whilst overweight and obesity are related to type 2 diabetes, they're not synonymous. Some people can be overweight or obese and not have type 2 diabetes, and some people have type 2 diabetes without the other. But there is a significant degree of overlap. And also we know that rates of all three have gone up significantly since the early 80s with the introduction of the low-fat dietary guidelines, and we've spoken about that previously, and the numbers are pretty stark. Over the years, I have seen people lose significant or amounts of weight that the body needs to be lost, and their diabetes markers have gone from above the cutoff, and there is a marker called glycated hemoglobin or HbA1c. The diabetes cutoff is 6.5. They've gone from above that to underneath that, or seen their levels go from maybe 9 point something to 7 point something by making dietary change and weight loss. And for some people, they can end up at a point where I've said to them, if we had looked at this blood test, we've never seen you before, we know nothing about your background or history, we could say you don't have diabetes because the numbers tell us that you don't. Now, when we look at all this background, we can see where you've come from. Whether we want to say this is in remission, whether we want to say it's cured, whether we want to say it isn't there, look, this is playing a little bit with jargon, but ultimately for that person, that's a significant benefit. obviously. And for some people, they are able to reduce. In fact, most people, when their sugars come down, are able to reduce medications. Some people end up being able to come off medications. Now, obviously, don't do that without consulting your doctor and having your blood test results. Weight loss is not conceptually difficult. Now, immediately you're all going to scream, well, if it was so simple, why isn't everybody doing it? Now, putting it into effect, or execution, if you like, may be more difficult, but it's not conceptually difficult. You don't need to be a rocket scientist. You don't need 3 degrees. You essentially need to change your dietary patterns and can take in less calories, and in particular, take in less refined carbohydrates. And it's also helpful to do some additional exercise. So conceptually quite straightforward, but not everybody is quite able to come at it. Again, human beings are human beings. It doesn't make you a good or a bad or right or wrong person, but it is what it is. But essentially what this is saying, what this research is saying, and it confirms what some people have been arguing for many, many years, is that how we look after ourselves makes a massive, massive difference. Often the medical profession tends to sort of give a bit of lip service to lifestyle changes. Yeah, diet and exercise is important, but here are some tablets. There's a role for medication. It's not either or. It's not right or wrong to take medications. If you need them and they're doing you benefit, then you should be taking them. But if you can change dietary patterns and reduce weight and bring diabetes markers down to a point where they are now in the non-diabetic range, and you can do that without medication, well, that's a really, really good thing. And it doesn't tend to get a lot of airplay. Again, partly because there's a view that not everybody will do it, and not everybody will do it. That's fine. Everybody's different. But also, again, it's hard. There's not a lot of money if people are looking in it for anybody, if people are looking after their own health. And that's a little bit of a subliminal line that runs through it. In particular, with public health messaging, if you're a university academic, you're not going to get as much funding for your beloved programs. You can't scream that the government needs to throw money at me if people are actually able to sort out their problems by themselves. So, what are some of the take-home messages out of this? Number one, really good news that potentially 80% of people with type 2 diabetes may be able to reverse/cure, whatever term you like to use, by making some dietary changes. And obviously losing some weight with that. It won't be for every single person, and how much weight one needs to lose is also going to be different for different people. How the body responds, different for different people. But I think we can be pretty happy with those numbers. Number two is it doesn't have to be difficult. Essentially cutting down or out refined carbohydrates, eating like your grandparents might have eaten, protein, meat, fish, chicken, vegetable proteins, if that's your preference, some vegetables, drinking mainly water, cutting out beverages which have got calories, doing some regular exercise. That is the basics. Now, how much you consume is also a function because good food also does have calories. But if we can get to the basics and just make it less complicated and follow the basics, then, like a lot of these other people in this research, you too as an individual can take control of your health and improve your health. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like and share. You can also follow it on all the socials. There'll be new content uploaded each week.